Hello and welcome to Healthy Living. I'm your host Melissa Hodgson, and we're talking today about St. Tammany Cancer Center, a campus of Ochsner Medical Center. We'll talk with Jack Khashou, the administrator of the Cancer Center, Dr. Elizabeth LePere about integrative oncology, and then we'll talk with Ashley Uze, registered dietitian at the Cancer Center, about the importance of nutrition and diet when fighting cancer. So Jack, welcome to Healthy Living. We're glad you're here.
Thank you for having me.
So I guess first off, as administrator of the Cancer Center, connect the dots for us, future and past. The new St. Tammany Cancer Center is a campus of Ochsner Medical Center, and it's the continuation of decades of partnering in cancer for St. Tammany Health System. Tell us a little bit about how we got where we are.
Sure, of course. St. Tammany's been recognized by the Commission on Cancer since the 90s as a site. So we've been accredited for a long time, so a long legacy in oncology. And this is really a connection, to be honest, not just between our cancer program at the hospital, but it connects obviously some of the outpatient services that we've provided, in different locations throughout the years with our Ochsner partnership to provide the continuum of care. A lot of folks believe that only oncology care happens maybe in a cancer center or a cancer building. But really, a lot of the care happens at the hospital with the diagnosis and the treatment pieces. And with our Ochsner partnership, we're able to offer a lot of things like integrative oncology, which we'll talk about in a little bit, and really access to some of the tertiary, even quaternary care that they provide at the main campus. So really a nice connection between the legacy of being a hospital who does a lot of diagnosis and treatment with a tertiary quaternary partner.
Fantastic. So really you're talking about a complete cancer program, and this new facility, the Cancer Center, is a bit of the heart of it, but it's not the whole story.
No, that's correct. That's correct. Just, obviously a lot of the physicians are in the building that do a lot of the diagnosing and treatment and the survivorship pieces, but so much work is done outside of that building in other venues. So yes, it covers the continuum of care, which is important when you're going, for the care of these patients, because it's very, it's complex and there's a lot of different entities that need to be involved. So it's good to have, obviously, all the entities kind of working together in one medical record and one program.
Right, so all of the entities working together, that brings to mind in that new center, yes, it's a beautiful new 75,000 square foot building and everybody's excited about how gorgeous it is and just what a zen feeling it is to be in there with the art and the light, the natural windows letting light in. But when it comes right down to it, it's also important that we have all modalities in the same place.
Yes, we do. We do. And we have consolidated most of the modalities there. Obviously, we do advanced imaging, we have radiation, infusion, of course, and the clinic piece, but we also have some of the services that aren't directly related to medical care, which is, in our lanyap services where we're doing the integrative oncology piece. Acupuncture is part of that focus. Our dietitians obviously doing a lot of the work there too. So yes, we do have a lot of the medical services there, but I think in this project, in this building, we've really provided some of the social components that go into caring for these patients, which is new for us.
Beautiful. And so you have that social aspect and the integrative aspect. You have chemotherapy.
Yes, ma'am.
You have advanced imaging and radiation, oncology. Surgical oncology wouldn't occur inside that building, but it is a part of our cancer program, and it is an exceptional area for St. Tammany Health System. Can you talk a little bit about our cancer surgery?
Yes, actually, that's one of the parts that we're really most excited about, because I think everybody traditionally talks about the medical oncologist and the radiation oncologist. But really, an effort also to be in that building is to provide multidisciplinary clinics with some of our surgeons in our community and some of the surgeons from the Ochsner main campus to provide a more streamlined clinic approach. So, for example, you don't have to see that linear experience where you see a doctor in one building and then maybe multiple days or many days later see a physician in another building. We're hoping that in the near future we'll be able to see for each site, maybe see 1 or 2, 3 doctors at the same time. Maybe not simultaneously, but within the same visit, and they've conferred over the patient care, and they're really making recommendations for treatment options and outcomes, and having a conversation with the family potentially, who can hear from multiple physicians at one time. So the surgical oncologists are very important to our program, and in that building, the goal is to provide multidisciplinary clinics where they could see patients potentially with the medical oncologist, the radiation oncologist, or maybe even some of the medical specialists that we have in our community who are going to rotate through that building also. So very important to the program.
Fantastic. So for example, a local Covington urologist or gastroenterologist could be part of a multidisciplinary approach. a breast surgeon such as Dr. Angela Bonagera, who is a part of St. Tammany Health System, could be right there with those other modalities in the center in that multidisciplinary approach.
Yes, yes, that's actually the goal. I think breast is a good example. They may want to have a clinic where when they're sharing patients with a medical and radiation oncologist, one morning where all three disciplines see the patient at the same time, and then obviously move forward. It actually helps a lot with the patient anxiety too, because you're not, once again, you're getting kind of the full picture, and you're not trying to connect the dots on your own, which we hear a lot from our patients of how frustrating, quite honestly, can be sometimes to try to piece information together from multiple physicians, multiple locations. So yes, that would be a great example. Breast, lungs, another one. We like to, GI is another area. Maybe the gastroenterologist seeing the patients with a GI surgeons. Maybe just a two-person type multidisciplinary clinic visit. Yeah, but that is the goal, and I think that'll be something that patients will really benefit from.
Fantastic. And so that new space takes into consideration that you have people who work there all the time and people who may be coming there on a rotating basis or on a specific patient visit basis.
Yes, yes. Yeah, that's the plan, is, because obviously all the disciplines don't have to be there every day, so we are working on a rotating basis, but it's got to be frequent enough so that patients don't have to wait, because access is important. Obviously, especially when you have a diagnosis, you want to make sure you address it quickly. So, not that it's going to be every day, but each discipline should be seen once a week at least, so that if you have a new diagnosis within that time, they're able to get in quickly and really get a game plan that hopefully will help them feel better about moving forward.
And that speed to care, I think, is one of the things that was crucial to the decision to move the center, right? St. Tammany Cancer Center actually has been growing and outgrowing its space for some time. Was it in 2016 or 17 that it was first reconfigured?
That's correct.
And then expanded the next year. And then once it ran out of room, you began to look at how to continue to serve more North Shore patients locally and not have them travel far for fast care. And that's ultimately what resulted in the building?
Yeah, and yes, we quickly became more of a community cancer center and really become a regional cancer center. And a lot of that is a testament to the sophistication of our medical staff. We have a lot of physicians who do things that maybe in previous years they would have gone to other locations to get the diagnostics or even the treatment options. So that, along with just wanting to provide more support services, which we ran out of room, around the patient care piece, not just the medical pieces, really caused us to take a look at this and say, how can we provide more services to the patients, and how we get more physicians involved in the program who are seeing these patients maybe in different locations, and to my earlier point, causing that frustration with that fragmented care. So we really wanted to streamline the experience.
So a much more patient-centric experience. Patients can expect most of what they need to be in one location.
Yes.
And on a routine basis, if they need labs or things like that, those are going to be available to them at that visit.
Absolutely.
And they'll have the multidisciplinary opportunity that you talked about, where maybe medical oncology, radiation oncology, surgery, or specialties like urology, gastro, et cetera, may be collaborating together on their case at that location. So that's pretty exciting. And then from the standpoint of that decision to move and running out of space, I have a mental picture of the old cancer center. As we grew and became capable of caring for more people, we kept reconfiguring and finding a way to serve more patients in that same square footage. But now, in this 75,000 square feet of open air space, we've been able to create these pods where a patient and their caregiver can spend that infusion time or what have you, able to see out.
Yes. I mean, that's exactly. I mean, one of the things, obviously, is patients come from caregivers, and one of the things that we want to do is create a better caregiver experience also, not just from the patient's perspective. So in our former, unfortunately, obviously, volumes have grown, incidence rates are up, but on the flip side, I know survivorship and outcomes are improving all the time. So we have more survivors than ever, so that's really a great situation to be in. So yes, when we constructed the building, you mentioned the lab, and lab's on the first floor. We made it convenient because the patient can run in and run out. They don't have to go through the whole maze of a hospital piece, so that's part of what we thought about. In the infusion suite, we added spaces. We have an outdoor balcony because patients sometimes are there for a long time, and they could, maybe just want some fresh air. So we really thought of how to do the pods where a caregiver could be involved, and we also thought about how we can provide some amenities. Soon here in the next 6 to 8 weeks, we'll also provide a coffee shop and things that, some of the things that you don't think about when you're there in a building for a long time to help make just the day go by a little bit faster.
Beautiful. Well, Jack, thank you so much for coming to tell us about St. Tammany Cancer Center and the campus of Ochsner Medical Center. We're excited to have it up and running at I-12 and Highway 21 in Ochsner Boulevard.
Thank you for having me.
All right. You're watching Healthy Living. I'm your host, Melissa Hodgson with St. Tammany Health System. We'll be back next with Dr. Elizabeth LePere to talk about integrative oncology.